We've all heard of them. Many dread them. Some get them confused with other diagnoses like glaucoma. What even are these cataracts? And is surgery really the only option? All that coming up. Cataracts ultimately are a blurring of the lens inside of the eye. But how and why does this happen? Is it reversible or even preventable? Changes in the proteins of the lens are primarily responsible for cataracts. They group together and form cross-links, and that makes it blurry to see through. What they should be is nice and parallel. That allows the vision to go through, but when they cross over, things get blurry. Kind of think of it like if you're looking through your blinds at the street, you're going to be able to see through to the street. But have you ever seen one of those pictures or videos of the dogs who get all caught up in the blinds and they get all tied up? You're not going to be able to see through that the same. That's kind of like cataracts. I'll talk about what you can do about it in a little bit. There are many things that can cause cataracts to develop prematurely. That's why being educated about your eyes can be so beneficial. So I want to thank all of those who watch, like, and especially subscribe, because that helps these videos to be recommended to others. And my ultimate goal is to educate people about their ocular health. So if you haven't already, please like and subscribe. Cataracts are most widely known to be associated with age. But did you know there are things that can actually cause cataracts to develop faster? These things would include smoking, UV exposure, radiation, trauma, excessive alcohol consumption, steroid drugs, illicit drugs, systemic diseases like diabetes and high blood pressure, especially if they're not well controlled, and any history of ocular surgeries. Cataracts aren't just limited to those of a greater age and the experiences that come along with it. They can also be present at birth or develop during childhood, which is usually related to genetics, serious pregnancy complications, ocular inflammation, or ocular tumors. Or they can occur due to similar reasons as adults, like radiation, trauma, and steroid medications. You can look at this list and see that some of these causes are preventable, like avoiding bad habits or certain compromising lifestyle choices, wearing sunglasses outside, and maintaining optimal health to prevent systemic diseases. But some we simply cannot avoid. So that brings us to, are they reversible? The short answer is no. The long answer is that cataracts are something that develops normally with age. Yes, there are things we talked about that cause them to develop sooner, but they're just a normal part of the aging process like wrinkles. Those can't be prevented. There are no drops or injections that are available to reverse cataracts at this point in time. So don't fall for those eye drops that are out there that claim to melt or dissolve cataracts, because that simply isn't the case, and you wouldn't want that either. If they were actually melting the cataract, they would be melting the lens along with it, and then you would be missing an important part of the eye that helps to focus the light. It just wouldn't work that way. As of right now, there's no FDA-approved medication that helps to improve cataracts. Yes, some people experience sort of a placebo effect when they do take these eye drops. They feel like their vision is improving, and that's typically because the eye drops offer a little bit of lubrication to the eye. So that helps to refresh the corneal surface and can sometimes give people with dry eye clearer vision temporarily, but then they'll start to notice that the improvement stagnates, and as the cataract continues to develop over time, their vision will also continue to decline. At this point in time, there is only one way to treat cataracts, and that is by removing them surgically. But I have great news. Cataract surgery is one of the most successful surgeries that exist, and that's because of the low rates of complications, high rates of success and improvement of vision and quality of life, quick recovery with minimal discomfort. It's typically an outpatient procedure, typically done with topical anesthesia, so the recovery is typically very quick. And cataracts never grow back, so the surgery never has to be repeated. And that's because the natural lens, which is what has those proteins, has been removed and replaced with a synthetic lens that does not have proteins that can develop the same issues as our natural lens. Now, you may have heard about something called a secondary cataract, but it's not exactly as it sounds, and I have a video explaining all of that you can check out. Not to minimize the complexity of surgery, cataract surgery would be performed by a surgeon with lots of training, a high ability and skill to adapt or react if any complications or things that are unexpected arise. Before we continue, I'd love to show you my new children's book that will bring any child's imagination to life. Let's check it out.
When you dream about the ocean, you can become friends with a jellyfish. You can breathe like magic underwater. You can talk to turtles. You can swim with a whale. What will you dream? What will you dream? What will you dream?
Since they're irreversible, what can you do to minimize and slow cataract formation? Well, you want to control the environmental and lifestyle factors that you can. And that would include wearing sunglasses to protect from UV radiation, eating a diet rich in leafy greens, fish, and nuts that contain antioxidants, zinc, vitamin A, C, and E. Stay hydrated, avoid smoking and secondhand smoke, no excessive alcohol consumption, manage chronic systemic conditions carefully, wear protective eyewear when necessary to avoid trauma, and prevent infection and inflammation by maintaining good ocular hygiene, especially for contact lens wearers. Be sure to see an eye care provider regularly to detect eye conditions early and treat them promptly to prevent long-term complications. If you found this information helpful, please like and subscribe and share with a friend. Thank you for watching, and I hope to see you next time.